Good evening, everyone. Thanks so much for joining us for Facebook Live tonight. Tonight's topic is men's health, and we have two of Mon Health's finest joining us tonight for Facebook Live. We have returning guest, Dr. John Batten, urologist here at Mon Health Medical Center. Thanks for joining us.
I'm glad to be here.
We're happy to have you back. And Dr. Ryan Walker, who's a primary care physician at our Fairmont location. Thanks for joining us.
Absolutely, happy to be here.
Yeah, you're new to the show. We're excited.
Yeah, very excited to be back.
All
Kind of
right.
back home for us.
That's right, yeah. And you're new to Mon Health, so we're excited to have you.
Yeah, absolutely.
All right. So our first question, we thought we'd start off with something real broad and get patients to get to know you guys. Who are you? What's your specialty? And what brought you to Mon Health? Dr. Batten, you want to start?
I'm a urologist at Mon General Hospital for the last 22 years, and I went to the University of Pittsburgh Medical School and then did my residency at WVU, and we fell in love with Morgantown, and we decided to raise our family here, and we haven't left ever since.
Perfect. Now, why urology? I'm curious.
Actually, it goes way back. When I was a child, I had some issues, and so I knew medicine, and it turned out my father-in-law was a urologist, and I've been with my wife since we were 15, so he kind of influenced me too. He was a wonderful man and had a big impact on me.
That's beautiful. That's awesome.
Yeah.
Dr. Walker.
Yeah, so Ryan Walker, I'm from Bridgeport originally. I went to school at WVU for both undergrad and medical school. Always really loved, the area in West Virginia. Through residency, ended up in Cleveland through the Cleveland Clinic and in Columbus for about 6 years. But between being back toward family and everything, brought me back closer to home here and everything. So now working at the Fairmont location with primary care, right in the technology park and everything, which is great, both close to my parents and my wife's parents and everything there. So happy to be it. I've always been impressed with Mon Health and everything. So it was great to have the opportunity to be back close to home and as well as be part of the team.
And it's amazing, everybody knows you. You come from a family where everyone knows you. We went out to a few clinics together a couple months ago and everyone knew Dr. Walker, so it was pretty cool. So you can tell that you're from the area. Yeah.
It does help. It gives the connections, sure.
Yeah. So our very first question, a really great question. What is normal and what's abnormal when it comes to urination and the prostate? Dr. Batten, you want to take that?
That's a fairly broad question, but what is normal is somebody should urinate comfortably. They should not have to go too often, which is usually more than every 1 to 2 hours. Okay. They should never have pain or blood in their urine, or have pain when they go, or have blood in their urine. And they shouldn't have to get up at night more than once, maybe twice. Just to get started, those are, the main things.
Gotcha. Okay. Good answer. Dr. Walker, this is probably geared towards you. I'm always tired. What's causing my fatigue? Should I be concerned about my testosterone levels?
Sure, yeah, again, pretty broad topic, with that one, again, I would say in this, can apply to many things in medicine, but when it comes to fatigue and feeling tired, some of it can be a change from baseline, kind of a point, if this is something that's new or changing from where it was, certainly that can be abnormal, a point of basis of, is this something that's new or changing your life? Are there other things there? Certainly testosterone is a common question nowadays and a hot topic as far as whether that can be it, and that's certainly one thing that it can be. I'd encourage, my patients to have, an individualized discussion with their physician as opposed to seeking out testosterone straight. Certainly there's a lot of other medical things you'd want to investigate and look into as well as part of that, and testosterone can be one of those and certainly a common thing, but wouldn't be the only thing, and certainly would want to make sure it's part of a comprehensive workup with it as well.
Gotcha. Now, when you say testosterone is a hot topic, what are people doing now for that?
Again, and this is, and certainly again, being in Columbus and listening to the radio, we hear a lot of people, and I have a lot of patients come in because they hear ads for testosterone replacement, trying to find it in some places that do specifically that do, testosterone, and, whether it's labs looking into it or just replacing it and doing that stuff, which again, for some people can be the right answer, but it's not the right answer for everybody. So you just want to make sure that it's, part of it, if fatigue's the concern and some of these things, want to know what the actual question is or what the concern is.
Absolutely. Okay, perfect. Thank you. Next question. Are annual visits important for men? Why, and what do you test for at them?
Yeah, I would say, as a primary care, and certainly with, annual visits, I think are important for people of all ages and everything. As far as what's being tested at them, again, it's going to be kind of individualized for everybody. I mean, for a lot of people, as you get into your mid-30s to 40s, certainly, you start looking more into some of the, cholesterol screenings and some of your annual exams, an annual health exam to kind of go over that as an individualized things to try to find and prevent things that could be causing problems later down the road and everything is the important thing. Depending on, your age and everything, certainly there's individualized things for patients for screening. Again, talk a lot about labs and screening tests like colonoscopies and stuff like that and everything.
Perfect, thank you. Dr. Batten, questions for you. What are signs of prostate cancer?
Incredibly, there aren't very many signs of prostate cancer. But that's what we're all afraid of, but most urinary troubles in men, middle age and older, don't have anything to do with prostate cancer. By the time, it's usually an enlarged prostate. But symptoms specifically to prostate cancer, it might be hematuria or blood in the urine. It could be pain on ejaculation, blood with ejaculation, but that's, again, those would be later stages. It might be that their kidneys are blocked up, that they have trouble, or they have trouble urinating, but most commonly the symptoms that men experience are more due to your basic enlarged prostate. That's why it's so important to get a PSA, which is a blood test that all men should consider getting at the age of 55. The American Urologic Association recommends getting it at the age of 55 and discussing it with your doctor, the importance of it and whether it's something that would be good for you at your age, but until you're about 70. And it's also very important to get a prostate exam periodically after the age of 55. If prostate cancer runs in your family, you should consider starting to get the blood test, the PSA, at the age of 40 and start getting prostate exams every couple years. Okay. The PSA, why it's so important is it can pick up prostate cancer 10 years before, maybe even more before someone knows they have it.
Are younger men being diagnosed with prostate cancer, or is it kind of, 50 and above? And
the main group is 50, 60 and above, but we've found it rarely, but we've seen it in people in their 40s. It's uncommon, but it can happen.
Okay, thank you. Next question, good question. A good number of men have said that their health wasn't something they really talk about. So why is an annual visit important if I'm healthy? That is a great question. I think men think that they're kind of invincible a lot. And they're like, if I haven't had any issues, I don't need to go. Sure. So why is it so important?
Yeah, I think you see a mixture of things, and certainly I talk to a lot of people, and hesitate to single out men, but I know kind of stereotypically that's kind of where it comes in. I think a mixture between thinking you're invincible plus also kind of just not wanting to have to deal with it sometimes, sure. and thinking that that's I have other things to deal with until, and I'll tell you, kind of. I feel like as you see this among different cultures, certainly Appalachian culture and stuff like that, there's a tendency, I think, a lot of times to not go to the doctor until something's really wrong. And because of that, you see things present much later than they should be, which I think is the importance of the annual exam. And going, because even if you think you're healthier, if you think it's something that may not be a problem, having that annual exam to talk to your physician about it, have an exam, go over some, where you do some basic vitals, blood pressure, detect these things that you may not have any signs or symptoms of. Hypertension classically is something that you may not have any symptoms of, and you may feel healthy, you may be just fine, but could cause a lot of problems. Certainly cardiovascular-wise, again, you talk about, kidneys, any organ of the body, it can cause problems for. So trying to detect that, and a lot of people won't know unless they go to the doctor to have an annual exam.
It sounds like family history is huge too, no matter what your age is, right? So that's something that, you need to talk to your doctor about too.
And along those lines, it's, again, that's where having that discussion, that annual exam, because it's hard to give one answer for everybody out there as far as what the best, without having that discussion with your doctor about your family history and what may be important to you that's not the same for everybody else.
Makes sense. Got it. Thank you. Next question. Dr. Batten, how often should I be seeing a urologist?
Well, Thankfully, I mean, most people don't need to see a urologist. We are a specialty. We're here if you need us. Many times it'll be determined by the primary care physician whether you need to see us or not for a particular problem. Many problems the family practice physician can manage it themselves, but if they're concerned for prostate cancer or things are a little bit more extensive or involved that they're uncomfortable with it, then they'll refer you to a urologist. Of course, anybody who is interested in vasectomy or things like that, they can call us and get set up, or people that have had kidney stones and they've been to the emergency room. But usually a primary care physician will refer them for urinating blood. That is not normal. So if you see blood in your urine, don't just say, oh, I was lifting something heavy or I ran a marathon. That's not usually a good sign. And at least let your primary care doctor know, and they can start some tests and they'll refer you if it's appropriate. But there's many, many things that they look for that you may not even think of that might be cause for a referral.
And that's actually along the lines of one of the questions. Does someone come straight to you, or do they have to be referred by their primary care physician? How does it work?
Because in West Virginia, unfortunately, we have a shortage of urologists, an extreme shortage. There's a lot of patients, so our primary care doctors do a good job seeing these patients and deciding if it meets the criteria to come see us. In a lot of situations, if we see your family member and you're worried about a similar problem, we'll see you directly if you already have family as a patient, or we will, for certain procedures like vasectomy, we'll see the patients directly.
Okay, makes sense.
Yeah, and I'd say, from a primary care point of view, and this can go for a lot of specialties, but certainly in this case, a lot of symptoms that patients think they have, seeing a primary care to kind of isolate exactly what's going on. Sometimes we can take care of it, or sometimes it's not related to that, so to make sure you're actually getting to the right specialist in those cases as well, just for the efficiency for everybody is in that case as well.
Okay.
Yeah, he has a difficult job. Yeah, because he has to take care of it all and tease out what the real problem is. By the time they come see me, he's already made the diagnosis, and we just have to do the treatment. So we certainly are glad that he came back to West Virginia.
Oh yeah, sure. Yeah, of course. All right, next question. How long does it take to recover from a vasectomy, and when will it be safe to have sex again?
Okay, well, we ask that the gentleman after a vasectomy hold off from intimacy for 1 week. They can usually resume normal, vigorous activities in 2 weeks, 1 to 2 weeks. And they can go back to work as long as it's not something heavy or difficult in 3 days.
Gotcha, okay. I always thought it'd be longer than that.
If they're good the first 3 days,
Yeah.
and they rest, use ice, and listen. Yeah, our biggest problem is, and I'm just as guilty when I've had, all you have to do is ask my dermatologist. But if they are good the first 3 days of resting and staying off their feet, they do great.
Okay, good to know. Thank you. All right, next question. What are symptoms of kidney stones? Do certain foods or drinks cause kidney stones? Because I'm a big iced tea drinker.
Well, what sort of foods cause kidney stones? What most people, there's a huge list of specialty diets to prevent kidney stones, but what's most important is salt intake, to decrease your salt intake if you don't want to have kidney stones, and to increase your water intake. It's pretty simple. I try and keep it simple because people remember that. And quite honestly, if they drink plenty of water, stay hydrated, it's okay if they have an iced tea. For people that are at risk, I ask them to, if they have their iced tea when they're out to dinner with their family, that the next thing they drink is a tall glass of water. And so it's volume of fluids is important, and as we know now, salt intake is very important.
Okay, makes sense. Thank you. Next question, I'm guessing, Dr. Walker, how do I lower my LDL?
Sure. So always a good question. I guess the most generic answer is diet and exercise and everything with that. I mean, for a lot of people, and the fats in the diet, I think, is a big thing, and for, I think, a lot of the American diet, the red meats, the saturated fats, and the fatty foods, what your body does is basically takes those fats and turns them into cholesterol, and for a lot of those foods, it's bad cholesterol, it's the LDL and everything there. So trying to reduce the amount of those types of foods, the fatty foods, again, a lot of the burgers, the red meats, certain types of, cheeses, those types of heavy foods in the diet, trying to wean those down. And even as we know nowadays more and more over time that not all fats are bad, trying to replace them with healthier, leaner fats, your things like, salmon, avocado, mixed nuts and stuff can have a lot of good fats in them, and those will also help even out your triglycerides to lower that LDL and everything. So, and then exercise, certainly trying to get, exercise and cardiac exercise where you're raising the heart rate. Doesn't always mean you have to go to the gym every day, but finding something you do to raise the heart rate, get outside. Certainly during the summer months are a bit easier with that than sometimes the winter months, but this time of year getting out and exercising can help as well, certainly.
No burgers, that hurt my heart.
Right, I know, the burgers and the hot dogs this time of year, cut those down.
That's hard to do.
That's not the good fat.
That's not the good fat.
Right.
My goodness, I wish
Just
it was.
checking.
And for a lot of people, it is portion size, I would say. We talked, I think, for a lot of patients, certainly there's a lot of diets out there you can look at, and certainly there's a lot of strict ways to kind of really get it down. But I think for most general population, it's not about trying to tweak everything. It's really about portion size and trying to wean down the fast food, those big things, and I think that for a lot of people will go a long way.
Gotcha. You always hear about portion size. Next question, how old should I be when I start getting colonoscopies?
Sure. So colonoscopy has been a recent change. Actually, usually traditionally it had been age 50. The guidelines, the U.S. Preventive Task Force, and a lot of the guidelines have moved it down to 45. Has been so when you're 45, looking into colon cancer screening of some sort. The colonoscopy is still the most recommended test, though there are other options out there depending on your risk factors and everything. But a colonoscopy at 45. I would say, as kind of an aside and everything, I usually recommend to my patients, because of some of these recent changes, checking with your insurance and everything there. Sometimes there can be some stipulations whenever you change medical guidelines and insurance is following, just to be aware of what you're doing and everything there. But they seem to follow that, so 45 would be the...
Okay. What if you have colon cancer in your family?
It would be different. So colon cancer in the family depends on exactly when that family member, if they're a first-degree relative, and when they had, how old they were when they had colon cancer. Again, if it's a family member who is younger, in their 40s or 50s, then certainly starting at, screening 10 years prior to how old they were would be when you'd want to start looking into it and having that discussion.
Okay. Next question. Good question. Dr. Batten, where do you see patients?
Where do I see patients? In the office.
Perfect.
Our office is, our main office is up here at Mon General Hospital. The building, office building adjacent to the hospital, and our people will direct patients where to go, where to park, which is difficult right now, but eventually there'll be plenty of parking, but they'll direct them where to go. And then Dr. Shakiri Rad goes to Preston County, Preston Memorial Hospital once or twice a month. And in the near future, I plan on going to Stonewall Jackson Hospital, hopefully July 22nd. And that will be, for starters, once a month.
Gotcha. Okay, perfect. And Dr. Walker, where are you seeing patients?
I'm seeing patients right now in Fairmont. It's the office, the primary care office, and we have cardiology as well in the technology park right there off the Whitehall exit and everything. I think the address is the 1 Huntington Way exit right there. So it's not the emergency room, the Mon Marion emergency room, which is also around the same area, but the primary care office in the technology park area right there.
Beautiful office.
That's beautiful, yes.
Yeah.
It's I know they just moved into there just this past year, I believe. So it's nice, and certainly nice to have cardiology and some other specialties in, in the office as well.
Yeah, of course. Okay, next question. Dr. Batten, when do I need to start my prostate exams?
Well, again, like colon cancer, it depends on your family history. If your father or a primary relative had prostate cancer, especially at a younger age, like 50s, 60s, you should start getting your prostate checked at the age of 40. And that may or may not, with a PSA, but we recommend, most urologists recommend a PSA and a prostate exam. If it doesn't run in your family, at the age of 55, we start checking prostates. Now, if you have urinary symptoms, there's no reason, we check prostates in all men. It could be at any age if they're having difficulties. But 55 would be most men who do not have a family history.
Gotcha. Okay, thank you. Next question, Dr. Walker. I'm 40 years old. Do I always have to watch my diet?
Yeah, I mean, it feels a little loaded question. I mean, I would say, certainly you're right, depending on, personal medical history, certainly we're more strict and, we have more individualized discussion about what your diet is and what that means. And when you're younger, you can get away with these things a little bit more. But I would say at any age, I mean, watching your diet, trying to eat healthy is the best way to keep yourself healthy, to try to prevent problems from happening when you're, later in life and everything. So certainly, yes, I mean, trying to watch your diet even at those ages, 20s, 30s. I know it's, again, when you're in 20s and 30s, easier to kind of let that slide and kind of not do it. But yes, at any age, I think watching the diet and watching what you're intaking, again, we talked a lot about the fats, the, sugars, sugary drinks, sweets go, I think a long way for a lot of people to cause problems and stuff. So trying to minimize those types of things, and again, portion size with a lot of that stuff.
Gotcha. So. Okay. Dr. Batten. Why do I feel the need to urinate more often? It wakes me up a few times during the night.
Well, in men with enlarged prostates, the prostate actually blocks the urethra, the tube that we urinate through, and it starts very gradually, years before you know there's a problem. And what happens is the bladder has to force urine through an hourglass type narrowing. And over time, the bladder starts to get thicker and more irritable. And when it's irritable, when it feels like when it wants to empty, it won't give you as much warning. It'll squeeze more often, making you go more frequently, getting you up at night. So the primary treatment would be to relieve the blockage with medications or procedures such as UroLift, green light laser, or TURP. Now, outside of that, there's other reasons that cause you to urinate frequently, like infections, bladder cancer, but those are much more rare.
Okay, gotcha. Thank you. Next question: is heart disease more common in men or women? That's a good question. I think I've always heard women, but maybe I'm wrong.
Heart disease generally in men is more common, higher risk at that. I mean, there are some studies in individual things like strokes that can be higher in women, so some cardiovascular things. But as far as heart disease and heart attacks, usually men higher risk for those. And again, the other reason that, again, I know we talked about patients of, both men, women of all ages, but certainly tonight, men, where we talk about trying to get in, when you're younger, again, in your 30s and 40s at least, if you're not, I'd say I see a lot of patients, it's not uncommon that, you're between your 20s and that kind of stuff, it fades away, but trying to get back in, follow up with those things to make sure that you're preventing anything from happening with that.
Perfect, thank you. What about sleep? Is sleep more important for me? I'm in my 50s. That's a good question.
So sleep important for it in the 50s, yeah, yeah, I mean, I'd say, I think we all could use more sleep. I know I could at times probably benefit from more of that and everything. Yeah, it certainly is, certainly sleep goes a long way. Everybody's a little bit different as far as how much they need. I think, classically always talk about getting that 8 hours of sleep, though that's not always the same for everybody. I mean, some people can do fine and function on less, but trying to get a restful, good night's sleep, all at once, trying to get, establish a regular bedtime. And we always talk a lot about sleep hygiene and trying to find ways to keep that routine. It certainly goes a long way, Again, we talk about fatigue and how that affects you. Certainly some sleep problems can cause even other problems, sure. Strain on the heart and the body and that kind of stuff and go on. So, but I know the most common thing people are concerned about is feeling good the next day and rested and everything, so.
So just try to get as much sleep as you can.
Right.
Okay. This is a good question. Being honest with my doctor makes me nervous. So why would it be important for patients to tell you the truth on how they're really doing?
Well, urology, this is, it's so important for any doctor to have a strong relationship with their patient, but what patients have to remember, especially the embarrassing questions or problems that we have to deal with in urology, they have to realize we deal with that every day, and and it's okay to let us know everything. Everything is of course private and confidential. Records are only seen by people that you allow to see them. But we have a great group in our at Mon Health urology practice here in Morgantown. Our mid-levels make people feel very comfortable, and I get compliments all the time on my mid-level. Our mid-level works with me, Megan, on how comfortable in 5-minute visit she makes people feel. And the gentlemen are surprised that they opened up. But that, you know, that's the type of people we have in our office. What you see is what you get. We're used to dealing with these problems, and the other physicians, Dr. Shakiri Rad, Dr. Hall, make their patients feel very comfortable. And we seem to get through to patients. And it's so important to let us know, because something you're embarrassed about may be a key symptom or sign of a serious problem like prostate cancer.
Sure, absolutely. Dr. Walker, what do you think?
Yeah, I'd agree. You know, I mean, certainly in primary care and among all these, I know there's, you know, always hard to go. A lot of people don't like going to the doctor, and a lot of people don't like, you know, being there with, you know, whether it's mental health problems or anything, you know. And that's where it is important to find a physician and somebody that you know, trust and establish a good relationship. Certainly in primary care, I mean, I think that's good for any doctor, but, you know, I know in primary care that we rely on that a lot. You know, I would say in general, I tell a lot of people, you know, I mean, there's a lot of tests that we can run, stuff like that, but it only goes so far sometimes if you're not going to be honest, you know, with us. You know, I think it's the only true way to really, you know, help people the most. And as you said, some of these things that patients don't, you know, think are a problem or don't know about or don't want to be completely honest with, you know, can make a big difference on whether it's a problem or what test gets run or what workup gets done and how they're treated and everything. So.
Perfect. Thank you. Next thing I wanted to ask you guys, Father's Day is coming up. Any plans for Father's Day? What are you both going to do?
I'm going to take call.
You're going to take
So no, you know, we're just probably picnic at the house.
Good. I hope it's nice that day.
Yeah, I would love that.
Yeah.
Maybe play golf with my wife.
Perfect.
Yeah, that would be nice.
There you go. That sounds nice.
What about you?
Yeah, I don't know. It's my daughter's going off to camp here this next week, technically on Father's Day, so she won't be here. So I've been told there's some plans prior to that. So sometime between now and Father's Day, there's some type of plan, but I've not been told what that is or what exactly that means. And my daughter's 7, so that could really mean any number of different things, honestly, at this point. So
Well, that's fantastic.
so there should be something fun at least this weekend.
Well, I hope it's a wonderful day for both of you. Perfect. Thank you so much for tonight. We really appreciate all your expertise and everything you guys had to say. And your questions were wonderful, everybody. Thank you so much for joining us tonight with Dr. Batten and Dr. Walker. Thanks for joining Facebook Live for Men's Health Tonight. We'll see you later. Have a wonderful evening.